The respiratory system oversees gas exchanges between the blood and external environment. The exchange of gases takes place within the lungs and the alveoli. Passageways to the lungs purify, warm, and humidify the incoming air.
The nose is where air enters the body and exits the body through the external nares divided by the nasal septum. The pharynx is a muscular passage from the nasal cavity to the larynx. It is divided into three regions: the naropharynx, which is the nasal cavity, the oropharynx, which is the mouth cavity, and the laryngopharynx, which is where the larynx is. The oropharynx and the laryngopharynx are passageways for food and air.
Larynx routes air and food into proper channels, passageway for air to enter lungs, connects pharynx and trachea, and plays role in speech. Trachea connects larynx with bronchi, lined with ciliated mucosa, expel mucus loaded with dust and other debris away from lungs.
Bronchi connects trachea and lungs, brings air to lungs at helos, divided into right and left bronchos. Lungs alveoli. Primary function is respiration. Gas exchange occurs and transports oxygen into bloodstream and CO2 out. Gas exchange occurs in alveoli.
System interactions. Circulatory works together to circulate blood and oxygen throughout the body and removing CO2. Nervous, the medulla oblongata controls breathing and the olfactory bulb identifies odors. Skeletal, ribs protect the lungs.
A system pathology, cystic fibrosis, most common lethal genetic disorder in the U.S. It causes oversection of thick mucus that clogs respiratory passages. Emphysema. The alveoli enlarge as the walls of adjacent chambers break through, and chronic inflammation promotes fibrosis of the lungs, which causes the lungs to become less elastic and airways to collapse. Chronic bronchitis. The mucosa of lower respiratory passages becomes severely inflamed and produces excessive amount of mucus, which impairs ventilation and gas exchanges and increases the risk of lung infections.